guys, welcome to Medico. My name is Faiza and today I will be continuing the vertebrae part 2. Now, joints between vertebrae in the back, symphysis and synovial. Before I get into what is all of this, let me just clear out what is a joint. A joint is a connection made between bones in the body. And now there are different types of joints, but in this video I'll just be talking about the symphysis and the synovial ones. Symphysis is a cartilaginous joint. What does that mean? Cartilaginous basically means that this is connected entirely. This sort of joint is connected entirely by cartilage, and these sort of joints allow more movement between bones than a fibrous joint would. But compared to a synovial, it is less. So synovial joints are very movable. They are highly movable, and we have four of these joints between each vertebrae, two up and two down. Like over here, you can see two up and two down, 1, 2, 3, 4. And the symphysis, there are two only. There's one and then there's two. That's it. So, depending on which region of the vertebral column do we look at, there are different movements by each of them because the structure varies in each of the vertebra. We can see different movements, but vertebra as a whole can do flexion, extension, circumduction, rotation, and many other movements. Now, symphysis between vertebral bodies. Now, symphysis, or the intervertebral disc in this case, basically, is a joint that takes place between two vertebrae. This intervertebral disc is important because it goes ahead and acts as a shock absorber if there's any sort of accident or any sort of strong movement of the body. They act as shock absorbers basically, and they protect the nerves. So this is made up of annulus fibrosus. The outer ring is the annulus fibrosus, and this is the nucleus pulposus. So when we do a dissection, we will see this is the annulus fibrosus, and this inner part is called the nucleus pulposus. Now, what is inside this? So inside this is the annulus fibrosus is basically made up of type 1 and type 2 collagen, whereas nucleus pulposus is made up of elastic inner structure and collagen fibers and water as well. It's very jelly-like, and it is there to withstand any force or compression or tension. So as you can see here throughout the spine, there are intervertebral discs between each vertebrae. And yeah, next is the synovial joints, or we call them zygapophysial joints. Now what happens here is that you can see this takes place between the superior and the inferior articular processes. So usually synovial joints, they have this sort of cavity inside them. So this is how we distinguish them. And so when we join them, there's like this sort of cavity that is there, and there's this articular capsule, this thin articular capsule, which we find. If you look over here, for example, there's this articular capsule, but over here it's not exactly shown. However, there is. Now, depending on the regions, like I said earlier, depending on if it's cervical or thorax or lumbar, they're attached very differently. So cervical, for example, they are slopped on inferior to anterior, inferiorly anterior to posterior, and thorax, it's very vertical. The shape of it is very vertical, and it limits flexion and extension, but it goes ahead and helps in rotation. And lumbar, it has joint surfaces and it's very curved. There's limited amount of movement, but flexion and extension do take place. Now you will understand more by the next slide. So for example, look at this picture. This picture is picture A, and this is the left facet joint, and this is the disc joint, and this is the right facet joint. So this is what I meant when I said, like, this is the cervical one, this is the cervical region one. So this helps in flexion and extension because it's slopped from anterior to posterior. That's it. This is how it is slopped on. And it's very like inferiorly, this anterior part goes to the posterior part. Now looking over this picture, this is the thorax part. And thorax part, I said it helps in rotation, but there's limited flexion and extension. And these are slopped on, and It's very vertical. If you compare to this one, it's very vertical looking. And this next coming is the lumbar spine, which is they are very curved. Comparatively, they are curved, and these limit movement, but flexion and extension do takes place. Now, coming to the unconvertible joints, these are formed between uncinate processes below and the uncus above. So, uh, we also call this joint of Luschka. Another name for this is joint of Luschka. And you see, this is the uncinate process, and this is where the unconvertebral joint takes place. And so they're very small. They take place between 2 to 6 millimeters, I believe. And we can find them from C3 to C7. They go ahead and allow flexion and extension, and they limit lateral flexion in the cervical spine. So these are only there in the cervical region from C3 to C7. Now these 3 points are basically why is it there. So it's important in providing stability and guiding the motion of the cervical spine. It's important because it prevents posterior linear translation. Basically, it doesn't let the linear movements take place of the vertebral bodies. It does not. It helps to reinforce the intervertebral discs and protects for structures which are risk at disc herniation. So it helps in a lot of these things. Coming to the latter part of the video, which is about ligaments. Now, what are ligaments? Ligaments are these band of tough elastic tissue which are around your joints. They go ahead and connect bone to bone, and they give your joints supports. So you have ligaments throughout your body. And I'm sure everyone has heard about a person who has suffered ligament tear. Footballers usually get ligament tears because of the kind of stretching that they do and the kind of game that they play. It can be possible for them to get, it's a higher chance for them to get ligament tears. So now coming back to the topic, there are two major ligaments which are there, the anterior and the posterior ligaments. So anterior, it's attached superiorly to the base of the skull, as you can see here, and it runs down to the sacrum, and it is there between the vertebral bodies and the intervertebral discs. It attaches to them as well. Now, posterior longitudinal is posterior surface of the vertebral bodies, and it is there on the anterior surface of the vertebral canal. So vertebral canal is placed here. So this is the anterior part. If it's here, then this will be anterior to the vertebral canal. So and like I said, even anterior longitudinal was attached to the vertebral bodies and the intervertebral discs in between. So this is the same. However, the only difference is that in posterior longitudinal, there is a part from the skull till the C2. It is, we call that part as the tectorial membrane, because from external, from the skull till the C2 part, we call that the intercranial part of the skull, and it is, named tectorial membrane. That part, that specific part, is only tectorial membrane. Now, ligament flava. Ligament flava is a ligament which goes ahead and connects the laminae of the adjacent vertebrae, and it is there on each side of the vertebrae. So there are two basically. However, we call the singular part only ligament flavum. So for example, if I'm referring to one ligament flava, it's basically ligament flavum. However, both of them together, we call them flava. And they basically run from the posterior surface of the laminae below to the anterior surfaces of the laminae above. And they go ahead and resist the separation of the laminae when there's movement of flexion, and they go ahead and help in the movement of extension. So the thing you should remember about it, it resists inflection and assists in extension. And you can see they are here near the ligament, near the laminae part of the vertebrae. Now, supraspinous ligament and ligament nuchae. Ligament nuchae is like a triangle-like sheet-like structure which runs from the external occipital protuberance of the skull, which is right here. This is the external occipital protuberance of the skull, till the C7. We call this ligament as ligament nuchae. And this apex is attached to the tip of the spinous process of the C7. So the posterior comes here, the posterior longitudinal, and the ligament nuchae comes over here, right over here, very It's the perhaps the most last one that you can see. And it supports the head, it resists deflection, it helps reach the correct position of the head. For example, your head is towards the right, so it helps bringing back the head to its original position. And the posterior surface of that ligament, that specific ligament, it helps in muscle attachment. So the different sort of muscles that are throughout your back go ahead and come over here and attach. So supraspinous ligament is basically the continuation of the spinous process of the ligament nuchae, and it runs from the C7 to the sacrum. So ligament nuchae and supraspinous ligament, they're basically the same thing. However, we give them different names because from external occipital protuberance to C7, we call it ligament nuchae. And then from C7 to sacrum, we call it supraspinous ligament. So they are continuation of each other. And this is an important question that might come in your exam. Which ligament, for example, is the continuation of ligament nuchae, or which two ligaments continue each other or are part of each other? Then it comes the interspinous ligament. So this passes between the vertebral spinous process from the base of the apex to each spinous process, and it blends with the supraspinous ligament posteriorly. It blends with the ligament flava anteriorly. Now, if you look over here, these are the spinous processes of each vertebrae, right? So this interspinous ligament is between that. So this is the supraspinous ligament, you know, the ligament nuchae, and then this is the supraspinous, the last most, you know, ligament that you would probably see. And this over here in between is the interspinous one. And then, okay, if you look at this image, right, this is the ligament flavum. This is the ligament flavum, and this is the posterior longitudinal, and this is the anterior longitudinal. So in between, we have this interspinous ligament. In between the spinous processes, we have the interspinous one. So this is the anterior, this is the posterior, this is the ligament flavum, which runs between the laminae, and then there's this one which runs between the spinous processes, which is called the interspinous one. And then the last one, the most last one, is the supraspinous one. Okay. Thank you. If you like this video, please make sure to like, share, comment, and subscribe. To get more updates, click on the bell icon to inform you and keep you up to date with our videos. See you in the next class.